following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
Welcome to Doctors on Call. Our topic tonight, sports medicine. Two experts are here to answer your questions. Now here's your host, Dr. Raleigh Sullivan.
Good evening. Professional athletes aren't the only people who get injured playing sports. It can happen to weekend warriors too. Even if you work out regularly and are in good shape, accidents can happen. Injuries from overuse are possible for anyone involved in physical activity, even if you're just walking. When should you treat the problem on your own, or when should you see a doctor? What are the latest surgical techniques and treatments? What can you do to prevent sports injuries? Well, we'll get the answer to those questions and more tonight from our two guests, Dr. Barry McDonough, an orthopedic surgeon at WVU who specializes in treating knee and shoulder problems, and Dr. Benjamin Moorhead, an orthopedic physician whose interests include sports medicine. If you'd like to ask our guests a question, give us a call now. Our phone lines are open. So I think, Barry, I'm going to start with you. And I want to ask you, first of all, about very young athletes. It seems like there's been a rise in surgery for injuries with young people.
That's true, Raleigh, and I think a lot of that has to do just with the fact that more children in general have been participating in organized sports, which is actually a great thing from a fitness standpoint. However, that does leave them open to sustaining injuries, particularly ACL injuries at a much younger age, and that does create problems.
ACL being?
Anterior cruciate ligament.
So knee problems at a much younger age.
Essentially knee problems as well, but you will see a lot of shoulder problems as well, particularly in children that are active in throwing sports such as Little League Baseball and even T-ball.
Okay, well, we're going to get back because I want to know more about this surgery because it's kind of intriguing that there's more being done, but I need to get Ben into this. At this point, athletes, it seems like, are more vulnerable to sports injuries in general. Is that true? I mean,
yes. I mean, athletes, of course, are vulnerable because they're very active in doing that. But you don't have to be an athlete to sustain a similar type of injury. Really doing any significant physical activity, whether that's being a weekend warrior or out playing a game of basketball with friends, or whether that's just gardening or hiking and twisting your knee as you step wrong.
Is that right? Okay. Well, so tell me, since you brought this up, I thought we would talk some about athletes, but you've obviously brought in the whole subject of people who aren't athletes.
Yes.
Injuring themselves. So what kinds of things do you see as problems? I
mean, no matter what activity, whether it's something like I say as simple as gardening or activities around the house, you can obviously step wrong and injure your knee or ankle. But also you can have overuse type of injuries. Constantly doing the same motion repetitively, no matter what that is, can create problems with shoulder or elbow and can give you tendinitis or other overuse injuries.
Well, let's talk then about, and I'll open this to either one of you. There's a general encouragement that people should move and they should exercise. And as a matter of fact, it's recommended that people, at minimum, just walk. Mm-hmm. And it would seem to me that walking would be a repetitive motion.
Yes. Walking is a very good exercise for someone to begin in. And actually with the guidelines for physical fitness, one of the first things we recommend is walking. And I actually would recommend walking at a moderate intensity for 30 minutes, 5 days a week at the minimum. But if someone has been completely inactive, it may not be the best thing to jump from doing minimal walking around the house to 30 minutes, particularly up and down hills or other places. And so it is important to somewhat ease into those activities, but that there should be a guideline, like I say, of getting up to about 30 minutes at a time.
Well, let's talk then. You know, West Virginia, we've had this unfortunate reputation as being heavier than most other states. I mean, and I know this isn't specifically about athletes, but I was thinking about, you know, a lot of folks watching this out there who may not be very active. How would you guys approach them in terms of getting them started?
I think it's at some point a little bit difficult here becoming active, mainly from the standpoint that the hills are obviously a problem. People that haven't been active for a long period of time suddenly aren't going to be able to go out and walk, say, a half mile or even a quarter mile just because of how hilly the terrain is. So really finding an area that's suitable for you, such as flat ground, is somewhat difficult, but I would encourage all my patients to try and do something like that.
To at least get started at it. You know, I want to come back to this because I know that it's a big issue and talk about it a little bit more. We have our first caller. This is Donna from Monongalia County. Donna, welcome to Doctors on Call. You have a question for us?
Yes, I do, actually. For about the last 4 months, I've woken up a few mornings and my knee has been locked in like a bent position where I've had to literally have my husband had to take it and to just I'd go 1, 2, 3, and he would push it back into the place it should be. Is this something that I need to worry about, a kind of arthritis or something like that?
How old are you, Donna?
48.
48.
Well, I think it's something to certainly be concerned about. It could be any number of different things. It could be osteoarthritis, or it could be a tear of the cartilage in the knee called the meniscus. And oftentimes that can sometimes shift and move and get stuck and actually cause people to have such problems as the catching and locking that she's describing.
So what should she do?
Well, if it continues to be problematic, and certainly at this point in time it sounds like it is, I certainly wouldn't want to wake up like that every morning. She might want to talk with her primary care physician or even talk with an orthopedic surgeon and getting such simple things done as x-rays first, and just listening to her complaints with a physical exam as well may help get to the bottom of the problem.
Okay, well, that sounds reasonable. Let's talk about, you know, she mentioned arthritis. And obviously, as we get older, a lot of us end up with arthritis. What do you tell your patients with, you know, joint complaints in general?
With arthritis, is actually one of the treatments for early arthritis is staying active. And that's one of the harder things to do.
Well, that's interesting.
But it has to be activity within some certain restrictions. Oftentimes people ask about running and knee arthritis as being a very common combination. And running probably doesn't cause arthritis, but if you have arthritis, running will worsen the arthritis. And so it's important to modify your activity. So if you have developed some arthritis of your knees or hips, it's probably best not to continue running, but to change to a different sport or activity that's lower impact, which would be things like riding a bike, swimming, or even walking as opposed to running.
You know, I think there's it's interesting to hear you say this, because I think there are a lot of people out there that have the misconception that activity leads to arthritis.
Well, to a certain extent that is true, and you know, if you're, say, in your early teens or 20s doing a lot of activities that are high impact, such as a lot of running, jumping, twisting, or turning type sports, that can be true, but in general you want to stay active throughout your life. Because otherwise you can have, you know, problems develop more with arthritic type changes of the joints.
Yeah, and there's other reasons to stay active throughout your life besides just arthritis and being mobile. I mean, it's good for your heart and lungs and you know, your overall well-being. Okay, we have another caller. This is Lois from Raleigh County. Lois, welcome to Doctors on Call. You have a question for us?
Yes, I went to a chiropractor. I was having pain in the back of my right leg, and he diagnosed it as a Baker's cyst. And I was wondering what kind of treatment or therapy, or what can be done for a Baker's cyst?
Well, I'll take that, Raleigh, if you don't mind. In general, a Baker's cyst often occurs as a result of either arthritis of the knee, or it often can be the result of a meniscal tear or a tear of the cartilage like we talked about earlier. And a Baker's cyst is more or less a sign of something else that's going on in the knee. Doing things such as taking an anti-inflammatory as well as an occasional corticosteroid injection into the knee may be beneficial, certainly if it's due to arthritis. If, however, it's due to a meniscal tear, then that may be something that surgery could help. But in general, I don't operate on Baker's cysts because oftentimes they come back.
Do they go away on their own too?
They can go away on their own, and oftentimes they will. They can also fluctuate in size from time to time too. And typically when patients are having more problems with inflammation of the joint, that's oftentimes when they become larger.
You know, it's interesting, you said it comes out of the joint. She said her pain was in her calf, I think.
I thought she referred to the back portion of her knee, and oftentimes people will talk about calf pain too, and sometimes the Baker's cyst can actually cause pain in that general area, but more often than not, the cyst is actually coming from the joint, the back portion of the joint.
Okay. Let's take another question. We have Mary from Jackson County. Mary, welcome to Doctors on Call. You have a question for us?
Yes, I do.
Okay.
How beneficial is it for a person who has arthritic degeneration and bulging disc in their back for them to go through physical therapy and pain management?
Wow, what a great question.
It is.
Yeah. It can be very beneficial because not only are we treating, the actual arthritis there, and you might think that therapy doesn't do anything for that, but by treating the muscles around there, that can help decrease some of the pressure across the back and help alleviate some of the pain that is associated with the arthritis, as well as, again, preventing other problems from occurring with stiffness and inactivity that often results as a sequela from the initial arthritis.
I think there is a misconception. Certainly in West Virginia, there's a lot of people with low back pain. And I think there's a general misconception that somehow physical therapy or exercise may make that problem worse, this sort of degenerative back disease that she was talking about. So could you just talk about that a little bit more, because I think it really is a problem in what people think they need to do, and in a way we have relied kind of heavily on pills to take care of this problem rather than physical therapy. So if you would just talk about that a little more, I think it'd be helpful.
Okay. In general, low back pain, particularly chronic back pain that's not related to an injury but's happened over time, does actually better with some activity. And it may need to be modified activity, not really high impact things again that are going to put a lot of extra stress. But again, helping to maintain some activity in the muscles and help get better support of the core muscles, which are sort of the muscles that stabilize our trunk in our body. That takes some of the pressure off that back and can help. And in general, even for sort of a flare or a acute sprain and strain of the back, one of the things is finding the best is actually to be as active as possible within some limits as opposed to complete rest. So trying to get up, move around as opposed to just laying in bed when you wake up and that back's hurting you. Trying to stretch out, trying to even just, like I said, beginning with walking around and then easily increasing your activity slowly.
Would you say, either one of you, would you say that physical therapy is really primary or key in importance for back pain? I mean,
I would have to say yes, certainly, and that is one of the things I typically recommend for all my patients that come in complaining of low back pain would be to first start them on a physical therapy program to really, again, reiterate what Ben had said, but to really strengthen up the muscles around there, because then again, it does take a lot of stress off usually the area that is causing pain.
Strengthens the muscles around that area. We have another caller. This is Paul from Cabell County. So Paul, welcome to Doctors on Call. You have a question for us?
Yes, I have bad knees. I've been told I need both replaced. I'm 64. I'm pretty well, can't walk very well, and definitely can't do exercise. But during them checking out my knees, they found something called fibrous dysplasia in my left femur. And they sent me to a cancer center in Columbus to check it out, and he told me not to worry about it. So I don't even know what it is. If you could explain that for me, I'd really appreciate it.
Yeah, I'd like to hear this too.
Sure. Fibrous dysplasia essentially is abnormal bone growth that can happen in certain individuals. It's different from what you typically worry about as far as cancer goes, where it's not lethal. It's just an abnormal way in which the bone grows. And oftentimes people, as they age, it will improve. Usually we'll see it in childhood at first is where it's noticed.
Mm-hmm. Is it usually painful?
Usually it's typically not painful.
So this might have just been a secondary finding since he had bad knees.
Correct.
Let's talk a little bit about knee replacement. I mean,
Sure.
when do you decide that somebody needs knee replacement?
Typically, when I talk with a patient that comes in with significant arthritis of the knee, I usually tell them if they're thinking about having a knee replacement, you want to wait until you can't do your everyday activities, meaning that you have difficulty doing such things as caring for yourself, going to get groceries, or even walking around the house. Because knee replacements don't last forever. Typically they last in the neighborhood of about 12 to 20 years, so at some point down the road you may have to have another surgery for a revision of a total knee replacement.
So you'll put it off for a while.
I try to. I try to utilize non-operative treatments such as anti-inflammatories, physical therapy, corticosteroid injections to help ease their symptoms.
So you use physical therapy, corticosteroids, and what else?
Anti-inflammatories.
So like, for example?
Ibuprofen, Motrin, Aleve.
Okay. How about the heavier pain pills? Do you use the opioids, the narcotics?
I typically do not. I reserve those for patients that have either had surgery or have such things as an acute fracture, because typically it's been shown in numerous studies that they don't typically help the disease process at all, the arthritis, and they can lead to other problems such as dependency.
Mm-hmm. Okay. Yeah, we could talk some more about that. We have another caller. I think it's Shirley from Cabell County. But Shirley, welcome to the show. You have a question for us?
Yes, I have severe arthritis. I've had 13 surgeries, and I also have scoliosis. I can't walk or stand for very long at a time. Is there anything that can be done for that?
How old are you, Shirley?
73.
73. And what medicines are you on?
Blood pressure, Darvocet, the purple pill for your stomach.
Purple pill for your stomach, okay. Okay, and...
Have the surgeries been on the back, or is that other surgeries?
I've had on my feet, on my knees, on my hips, and I just had one on my shoulder.
Lots of surgeries.
Yeah, I've had 13.
Okay. Obviously, severe arthritis can be crippling when it's in multiple joints, and it's somewhat, I don't really have an easy answer without seeing each of the individual joints and treating whether there'd be other treatment options with that. It would be reasonable to talk with possibly a pain specialist if we're at that point, and she's already on sounds like some pretty strong pain medications there. So I think working maybe with a pain specialist, if you haven't worked with an orthopedist, to individually look at each joint that's causing problems.
May be helpful. Talk in general about your approach to people with severe arthritis. As they get older. I think that she may be an extreme example. It sounds like she's really crippled from it. Yeah. But arthritis is a pretty common problem. I mean, how do you approach it?
Well, the most common arthritis, I think what you're referring to is osteoarthritis, and that's the arthritis with aging that occurs. It's sort of basically the wear, almost a normal wear and tear of the joints, and almost anybody as we age gets to some degree of arthritis. It may be in more of the knees in one person and the hands in another, and then of course there are unfortunate individuals that have it in multiple joints. So sorting that out and looking at it, most common that we see is probably the knees as the most common location. And the first thing I recommend using is just using Motrin or Tylenol over the counter. Okay. Along with combining with some exercise, like I said before, trying to begin with either physical therapy or slowly building up some exercise program for that knee. And then after that, we look sort of the next step is typically looking at injections, like a steroid injection to the joint, which helps get rid of inflammation, which is what causes most of the pain. And those injections can last for a few months at a time. One of the other options sometimes we have is bracing for arthritis, depending about the type of arthritis that they have. Many people, arthritis isn't necessarily susceptible or amenable to bracing, but sometimes we can use an appropriate brace to give some relief as well.
Okay, well, let me get our next caller. This is Gerda from Raleigh County. Gerda, welcome to Doctors on Call. You have a question for the panel?
Yes, I do.
Okay.
I had back surgery not too long ago, which went well. That's good. But I also have pains in my ankles and in my legs, a lot in my leg. And I was wondering, I walk, but I don't want to do physical therapy because that hurts. But I wonder if water therapy would be good.
Hydrotherapy.
Yeah, I think that's actually a great option for patients that have difficulty getting around, because it takes a lot of the stress off the joints, such as the ankles, the knees, and the hips. And oftentimes I'll recommend that to patients.
Yeah, I'm glad you brought that up. It seems like hydrotherapy is one of those things that would be, especially for people that have a lot of pain, might be a way of getting a lot of exercise or activity without hurting the joints. Is my thinking right on that?
Yeah. Being in the water adds buoyancy and takes some of the weight off the joints, so there's a lot less stress on the joints, and it's one of the great exercises and great types of therapy.
Let's talk about. Let's get back to talking about exercise and exercise-induced injuries. When should a person worry? You know, they've been out doing something, they've got pain. When should they worry?
Mm-hmm. Well, I think there's a couple of situations. And first, you know, obviously if there's an injury, something specific that happened, they twisted their knee or ankle or hurt another joint, you know, if they're not able to bear weight on that leg or not able to do normal activities, they should seek medical attention immediately, okay? If it's sore but they're able to walk on it, generally recommend beginning with what we call RICE therapy, which is rest, ice, compression, and elevation. So going through those things with the joint, resting, giving it some time, and see how they do. And if it calms down over a period of a few days or continues to get better, then it's something that they should be able to manage on their own. But if it gets worse, then that would be the time to seek attention.
Well, let me ask you this before I go to the next caller. What if they have swelling? Should they be worried about that? Say they got swelling in their joint, knee. You said knee was the most common.
Yeah, typically swelling that lasts for more than several days can be worrisome and problematic. Usually, especially after about 4 to 5 days, if you still have significant swelling, I think that would be another reason to seek out medical attention.
Okay, yeah, I think that seems to be a common complaint. We have another caller. This is Linda from Marion County. Linda, welcome to Doctors on Call. You have a question for us?
Yes, sir, I do.
Okay.
I have been diagnosed with rotor cuff syndrome, and my question is, I am not ready to have surgery at this time, and I have tried over-the-counter ibuprofen, Tylenol. Are there any other therapies that I can be doing to relieve the burning pain that I have with this?
Okay, we have about a minute for you all to answer that question.
Rotator cuff syndrome is a tendinitis typically of the rotator cuff and doesn't necessarily involve a tear or something that requires surgery, although it can if it's not taken care of. Along the lines of anti-inflammatories, I'd also recommend physical therapy can help if that hasn't been done as an option to strengthen and provide more stability to the shoulder joint and take some of the pressure off. That's more of a long-term solution. Another option would be looking at a possible bursa injection of the shoulder with cortisone or a steroid to help decrease the inflammation and help with the pain.
You know, the word steroid has gotten kind of a bad connotation.
Yeah.
It certainly has, and I think you have to clarify the type of steroid you're talking about. Certainly the steroids we're talking about aren't the type that are associated with pro athletes, and certainly with some of the problems that you see on television or on ESPN. The steroids we're talking about are anti-inflammatories.
Okay. Very quickly, anything you want to say to the audience about sports, injuries, exercise? This is your moment.
Well, as we've talked about already, I think it's very important to stay active, find some activity, and again, not just for the health of our joints, but for the health of our heart, lungs, well-being, mental health as well. And so find an activity that you enjoy and keep at it.
Yep. Life isn't a spectator sport, so get out there and have fun.
That sounds good. Okay, at this point, I think, we've been talking about sports medicines with Dr. Barry McDonough and Dr. Benjamin Moorhead. I want to thank both of you for being with us. If you'd like more information, see your family doctor or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. Raleigh Sullivan. Good night and good health.
Join us again next week for another edition of Doctors on Call.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.